You have a lot of history with the HIV meds, right?
I do.
Yeah.
I saw my first patient in 1983.
Okay.
I opened a private practice in 1987. The clinics that I had worked to prior to that time did not want me doing AIDS care in their clinics.
Oh.
This was such a taboo topic to discuss, and people were afraid, which was reasonable. We didn't know how it was spread. We knew it was deadly. Any patients that we tested during that time usually died within 6 months.
Oh, wow.
So I got involved and did 14 different clinical trials for HIV care. And the people that are walking around today, and I love you all, are people who got into clinical trials. And we were able to help them bridge them until the newer drugs became available.
And so just kind of maybe for everyone's edification, what is the current treatments look like for HIV? I mean, is it just you're undetectable? Or?
We have a number of once-a-day products.
Okay.
One pill once-a-day product with very, very minimal side effects.
Okay.
And they are truly, in my opinion, magical, and they're miracle drugs. Having been here when we had patients taking 26 pills a day with side effects so bad they could not leave their house.
Oh, wow.
Right. And this is really true. The GI side effects of these drugs were so bad, people could not leave their homes. So I helped with the development of the first one pill once a day pill. It was called a tripla, and now it's been passed over by newer drugs that are better and easier to take.
Okay.
We now also have injectable medications for pre-exposure prophylaxis. That's another big area of our practice, is that we want all of our patients, heterosexual and homosexual patients, to be on PrEP to help prevent the spread of HIV. We now continue to prevent the spread by having patients undetectable. Their viral loads are undetectable, so they cannot transmit the virus.
Okay.
So that's the purpose. And PrEP is 99.7% effective with the oral pill today.
Okay.
There's now an injection every 2 months. And there is an injection drug called Yestugo, which is now every 6 months.
Oh, wow.
So patients can get prophylactic treatment every 6 months. It's a double injection that we give them in the office. And it's being covered by insurances.
Oh, that's amazing.
Yes.
Okay. That's really great education. I was going to ask you about PrEP, so I'm glad that you said that.
Not all insurances cover it, but there are insurance companies that are covering the new drug every 6 months.
Do you see, I'm sure you're very involved with the HIV research and things like that. Do you see a cure coming for HIV?
There are treatments that are as close as we can get.
Okay.
You know, we're working with neutralizing antibodies, and there's all these new products that are antibody driven for a lot of different disease states. And the most recent one that I had seen at the last International AIDS Conference was one that gets into the lymph node area and can treat the virus where it's living. We can clear the plasma. We have the plasma undetectable, but there are reservoirs. And the goal in trying to cure HIV is the reservoir. Now, there is a cure available for HIV, but it's not ethical and it's not practical. That would be a bone marrow transplant. There are people who have two mutations in their system called the Delta 32 mutation. They received one from their mother and one from their father. Those people do not get infected with HIV. It's less than 1% of the whole population in the world. But there have been cases. The first patient was known as the Berlin patient, and this was years ago. He had leukemia, and he went through 2 transplants from a donor who was Delta 32 positive. He remained clear of AIDS until he died from other causes. So there have been a few more patients that have been cured. But again, it's not practical to think that a bone marrow transplant is the treatment for HIV. So the word cure is real. There are some other things coming that are allowing patients to take a year off of therapy. And they maintain themselves. And then at about a year, the virus starts to rear again. Even with continued treatment of the medication. So that is yet to be remained. Vaccines are still, Bill Clinton said we would have a vaccine in 5 years. We still don't have a vaccine. This virus is too smart. And it's just the kind of thing that many, many, many millions of dollars have been soaked into vaccine therapy. And most of us in the industry will roll our eyes and say, please, let's find something.
Right.
Let's find
right.
something.
Yeah.
But I think a vaccine is still not yet in our hands.
So kind of taking it full circle here, and I know some of this might be feel very basic, but how can people protect themselves from HIV?
Well, condoms are certainly the best.
Mm-hmm.
Condoms are what we continue, even patients on PrEP,
Mm-hmm.
they're coming in with syphilis, gonorrhea, chlamydia, and we have to continue to treat them. That's why if you're on PrEP, you see your doctor every 3 months.
Okay.
And every 3 months we do STI testing, sexually transmitted infection testing.
Okay.
And we find in the clinical trials, about 30% of the men participating in the clinical trials had an STI at 3 months.
Oh, interesting. Okay.
So that's why we go every 3 months.
Wow. Okay. So really just back to the basics. Use condoms.
Back to the basics. Use condoms.
Yeah.
You're still not going to be protected from these other infections.
Do you feel like that's the biggest challenge in the community, is that people think, okay, I'm on PrEP, so I don't have to worry about anything?
It is.
Yeah.
And people will deny it.
Yeah.
In terms of, well, I'm on PrEP, I'm okay. Well, how many of your last 5 partners were negative for STIs?
Right.
You don't know that.
Right.
You don't know that. And we have patients that have 5 partners a day, Grindr and all the other Scruff and other websites that are out there.
Yeah.
People are active and very active.
Right.
And so we want to protect everyone. So we give that message, don't forget condoms are still what we need to prevent the STI.
So for folks that are really sexually active, or maybe just sexually active in general, what do you recommend for that testing period? Is it every 3 months to get tested?
Every 3 months.
STIs?
And now there is a treatment called Doxy PEP.
Okay.
Post-exposure prophylaxis. You take 2 doxycycline tablets within 72 hours after having sex.
Okay.
It's been shown to prevent syphilis by 67% and
wow.
also reduces the risk of gonorrhea. It's not 100%, folks. It's not 100%, but we have a lot of people on Doxy PEP, and I will tell you from experience in our practice, the rate of syphilis is down in our population.
Oh, okay.
And I do accredit it to Doxy PEP.
Oh, interesting. That's great news, though.
Yeah.